If you suffer from chest pain or even back pain, the underlying cause may surprise you. Studies suggest that over 1/3 of patients who experience chest pain were actually experiencing symptoms caused by GERD. According to Healthline.com, 60% of the adult population will experience some type of gastroesophageal reflux disease, GERD, within a 12-month period, and 20 to 30% will have weekly symptoms. The specialists at Advanced Gastroenterology and Surgery Associates explain what GERD is and how they treat it.
GERD just means gastroesophageal reflux disease. People normally think that it's just acid, but it's just reflux of gastric contents into the esophagus that causes the symptoms. So it really is a motility problem. It's a problem of refluxing. We all have transient relaxation of the muscle at the end of the esophagus, so we all get a little bit of reflux. If we eat a pizza or fried foods, fatty foods, you'll get a little bit of reflux. But some people get it much more often.
Conditions where the esophagus does not function well to clear the acid when it is refluxed up. That's one. The intra-abdominal pressure is very important as well. For example, eating large amount of food at the same time causes the stomach to distend. So therefore, it causes acid to reflux up.
The most common condition we see in men, I think, would most likely be gastroesophageal reflux disease, especially with increasing obesity. We're seeing more and more cases of acid reflux, and the other reason it's important in men is that there's rising esophageal adenocarcinoma of the esophagus through a condition called Barrett's esophagus, and it's much more common in men than in women. So anyone who has a chronic history of acid reflux should probably have an endoscopy to look to make sure they don't have this change in the lining of the esophagus, which resembles the stomach. Cough is one of the extraesophageal manifestations of acid reflux. So people can reflux gastric contents all the way up the esophagus. It can present with hoarseness. It can present with asthma because of bronchospasm. I think it's mostly lifestyle. Like everything else, there probably could be some genetic components, but it's so common. And like I said before, we all reflux to a certain extent. I think it's lifestyle sort of exacerbates it.
For more information on GERD, as well as the specialists and procedures available at AGSA, please click the GERD story link on our homepage, yourhometownhealth.com.